Overlooking the majestic Pacific Ocean, Dr. Richard Merkin, President and CEO of Heritage Provider Network, sponsored HPN's third annual leadership retreat, implementing healthcare solutions, inspiring leadership and innovation.
We had people from New York, we had people from Arizona, we had people from all over California. I think there was so much, literally an aristocracy of talent, and the sharing of ideas, the sharing of what the future of healthcare could be with the individuals in that room was just outstanding.
Several hundred of HPN's top doctors, executive leaders, and their families gathered at a California seaside resort for 3 days of interactive seminars and presentations.
So the main thing for the 3 days is to come with an open mind, listen, learn, think about how you can apply the things that we talk about here to go back and make Heritage Provider Network a better, more successful organization.
Today we have a big treat, a real treat today. I want to introduce a real benefactor of America.
And that special guest benefactor is Dr. Mark B. McClellan, Director of the Engelberg Center for Healthcare Reform, Senior Fellow in Economic Studies, and Leonard D. Schaefer Director's Chair in Health Policy Studies at the Brookings Institute in Washington, D.C.
Healthcare is going to get a lot bigger. We're spending about close to 5% maybe of GDP now on federal health programs. That's going to go to something like 7% or so in the next 10 years. That's a lot of change. And then go to, under current projections, around 10% of GDP by 2030 or so, if we keep on the track that we're on now. It's all going to be driven by healthcare. Economy, debt reduction, deficit are going to be big, and healthcare is absolutely central to that. So what we do about that is absolutely central to the future of our country.
Do you think that the government could see an MA kind of program throughout the United States as a major part of the solution?
Under current law now, post-ACA, there are projections that Medicare Advantage enrollment is going to slow down, so starting after 2012. That hasn't actually been realized yet. In fact, CMS just made a big announcement this week that for 2012, good news, more people are going to be enrolling in Medicare Advantage according to their projections, and the premiums are actually going to be lower.
And when you talk to groups out there that are considering ACOs, one of the largest concerns is the cost of the IT and can they do it? Are we overemphasizing the need for IT as some sort of silver bullet to solve the problem?
I think so, and I especially think that this, sort of the usual approach with healthcare policy in a fee-for-service environment is, well, we're not getting paid for fill in the blank. Give me a payment for that, and then I promise we'll get better at it. So, IT, we now have essentially sort of fee-for-service type payments for them in Medicare. It's the meaningful use payments. I don't think those, they're either not big enough or they're not integrated enough with other reforms that need to happen in healthcare financing for most providers to use those effectively.
And I was wondering if you could speak a little bit about, has there been any thought to hiring Heritage for the United States to take care of the sickest 5% of the people?
Yeah.
HPN seminar presenters included Teresa Hodgkins and Lindsay Valenzuela, Innovations in Diabetic Medication Management; Marilyn Hartz, the SNP Challenge, a corporate-led initiative; Dr. Roger Ahn, Lights, Camera, and Telemedicine; Colin Robertson and Jesse Gamboa, Innovations in Palliative Care Integration; Dr. Osmundo Segol and Dr. Mark Hoffing, Achieving Accountability. Special guest speaker, Liz Weissman, talked about multipliers, how the best leaders make everyone smarter.
What I can tell you is I see in this organization, and him is a challenger, and that's one of the disciplines that we see often in multipliers, are leaders who use their knowledge and their insight to form the right question and to ask the big questions that upset the status quo, that provoke and challenge the assumptions, that start to shift the thinking off of the leader onto the organization and out into the community.
I think it's important for the physicians and the teams to understand that Heritage is a remarkable think tank, and that we have never essentially done things by the book. We want to essentially re-innovate and recalibrate the entire industry through meetings like this.
You cannot make anything happen if you don't have a team. And this is the best environment in which you can build a team.
He's brought us together to hear some speakers so that we can sort of think in the same direction, learn from these speakers.
Just to hear what your other peer groups are doing. You may have a challenge that they may have a solution to, or you may have an answer for a challenge they may have.
It's nice to meet everybody face to face. I mean, you talk to them all the time, you work with most of them, but it's really the face-to-face interaction I love the most.
And that camaraderie is just as important as the contents of the conference. Breakfast, lunch, and dinner on the terrace overlooking the ocean provides ample opportunities for coworkers to bounce ideas around.
We want to all to get together to see each other, and most importantly is to share the ideas.
And one of the best ideas of the weekend was the Sports Bar Olympics.
We had an incredible time. It was so much fun to see the competitive nature of everybody come out. The games were fantastic, and we just had a fantastic time spending a whole evening together, getting better acquainted as a family.
Had a fantastic time. I'd forgotten what a great athlete I am.
We've got an organization with 30 years of innovative ideas in driving healthcare change. And here was a chance to see firsthand what 30 years of innovation and thinking out of the box has done, and to talk about new ways to innovate.
Dr. Merkin has long been at the forefront of innovation, and I think as many people are referred to as visionaries, I think it's an accurate term when applied to him. So I think not only is healthcare ready for Dr. Merkin, but I think they're going to be increasingly reliant on him as we go forward.
When you recruit excellence, when you are surrounded by excellence, you expect and receive excellence.